It's working. Perfect. It's working. So as you can see, we are starting a webinar, a transplant child webinar this afternoon. And as you know, and as we already have planned, it's going to be about the quality and safety working group of the network. And the topic is perceived quality by patients, families, and relatives. And we usually have this first slide so we can introduce each other. I can introduce myself. I will introduce Dr. Weinberg, and then I would ask you, Stefano, to introduce yourself. Well, I present myself. My name is José Jonay Ojeda. I work at the Hospital Universitario La Paz in Madrid. I work in the quality management department, and I'm in the coordination of this working group, in the coordination center. We have a text Dr. Member. He's the director of this technical group. He works in the Karolinska Hospital at Stockholm, Sweden, and he's the director of the unit of transplantation of renal, pancreas, and heart transplantation. And if you could introduce yourself, Stefano, please.
Yes, I'm Stefano Pavanello from Italy. I'm a patient. I was transplanted exactly 7 years ago. I'm also a patient representative. I'm the president of our association in Padua, but we have patients all over Italy. Okay. And I'm new in and transplant child, but I want to give my contribution.
Perfect. That's great. Well, after this introduction or these presentations of ourselves, I just prepared this slide. Perhaps it's too much text, but it's just to explain that this is the third year of the network. In the previous years, we have developed quality standards in the transplantation quality standards, but mainly from the professionals' points of view. In fact, last February, we finished the collection of the activity records or results from all over the hospitals participating actually in the network. There are 18 of us, and we plan to use those results because the idea is to compare them with the standards, the professionals' points of view collected quality standards, in order to see how we are meeting those standards. And this year, the focus of the working group is on stakeholders in general and about patients, families, and relatives in particular. So we think it's a good chance to include that point of view, that essential point of view, in our quality standards. As I said, we have been talking for the first 2 years about, for example, what is the minimum quantity of transplantations that we have to have in a certain healthcare provider, or for example, what is the minimum requirements a transplantation team must meet. But of course, we are interested to include some standards that are provided by the patients. And as you have introduced yourself, of course, as professionals, we have an idea about that point of view. But of course, patients are the main source and the main way of getting that standards into our work. Just to end this introduction, I would like also to give a general reminder about the European reference networks, because as we already know, they have been developed by the European Commission as virtual networks involving different healthcare providers across Europe. And initially, there is no direct relation with the patient itself. In fact, to review a patient's diagnosis and treatment, what the coordinators of the different networks do is they convene virtual electronical advisory panels where different professionals, especially, particularly medical specialists, they can discuss which problems the patients have, in our case in pediatric transplantation, but there is actually no direct relation between the patient itself and the network. I don't know if perhaps as you are new, Stefano, you need any other introduction or explanation? What do you think?
No, I know about this. I know about this platform that you have as a doctor to discuss
That's right.
particular cases. I also know that patients and patient representative would like now to have access in some kind to
That's
this
right.
platform. I don't know.
That's one of the issues that I would like to introduce in this afternoon's webinar. Yes, of course, that's the idea. That's the idea, that we have to find a way to get not only the patient experience, but also to make possible that the patient feedback gets into the network as much as we can, and in the way that we can improve our standards. That's the idea. Yes, I agree.
So the biggest problem in that case, I think, it's privacy, because we don't have, all patients can't read data of people, so there should be a way to access to this platform without the particular data that are covered by privacy.
That's right. And in fact, what we can develop, as we will see in the following slides, is we can develop some tools. We will see in the following slides that there's an initiative for all the ERMs promoted by the European Commission, but there's already no tool for that. So we can discuss a bit later some of those tools. That's the idea. Perfect. So just to focus on the network and the particularities of the European reference networks, when we use the term stakeholders or interested parties, we want to point out that not only patients, families and relatives participate in this process, especially, as you mentioned, through patient organizations. As you know, we have a patient committee in our network, and that's actually the actual the actual procedure to allow patients or representatives to participate into the network. But as we will see, the process or the way we manage the network is mainly focused nowadays in the healthcare professionals. Overall healthcare professionals, all the healthcare professionals involved in the pediatric transplantation, but especially in those medical specialists that use this virtual system. No, it's called CPMS. No, you mentioned it before. So that's the current customer that we can access, the easiest one that we can access to get what we want about perceived quality. We don't have to forget that at a strategic and management level, we have some other important stakeholders like the European Commission, the member states. Every member state within the European Union and Norway have their particular structures in order to refer patients from one hospital to another. So that's also a stakeholder, an important one that we don't have that we have to keep in mind. And of course, hospital managers are a very important stakeholders, because this is not a particular initiative from a professional, but from the healthcare provider as a whole. And finally, there are other stakeholders that have been identified. We haven't yet worked with them in a structured way, because we are waiting for the European Commission to set up the principles, the general principles to all the European reference networks, in order to collaborate with them. And for example, those are the industry, not only the manufacturers or the suppliers of clinical devices, but also the pharmaceutical industries and the clinical trial promoters. And in our particular case, we have to keep in mind that every member state has a specific donors and organ allocation authority, because the donor and organ allocation is out of the scope of this network. Of course, we are aware of what is happening, and we work in our, some of the issues that can get to our network can be related to this, but we have to keep in mind that organ allocation has a specific legislation in the European Union that we cannot nowadays work those issues in our networks. And of course, another particular stakeholder that we have in mind, but we haven't yet focused on that, are living donors. I must not forget that. I don't know if you think there are other interested parties involved in pediatric transplantation and in this type of networks. What do you think?
I think that this list is complete.
Well, as I mentioned earlier this week, and that's the next slide, this is the actual network process map. This is a way of showing graphically what are our core processes. Those are in the middle. Our stakeholders are at the beginning and at the end of the network, of the process map. And through this map, what we are trying to show is that the network has two core processes. The first one is the knowledge, expertise, and research exchange between all the professionals involved in pediatric transplantation. And as you might know, we have working groups around clinical practice guidelines, or around research, or around training and education. And those are one of the objectives of the European reference networks. But specifically, and we have been working specifically in these first 2 years, is the panel discussion through the CPMS. CPMS is the platform that we can nowadays use in order to connect different medical specialists from different hospitals across the network. So if they have a patient or parents or family of those patients, that when they go to the medical doctor, or to the doctor, to the physician, and they have an issue that this medical specialist cannot resolve with their experience and expertise, every healthcare provider, clinician can participate through this CPMS, put that virtual consultation in this virtual tool, and they can get advice. We, in a structured way, we have tried to focus those types of advice in the pre-transplantation activities, in the transplantation activities, and the post-transplantation activities. There are different specialists identified through the different hospitals throughout the network, that have concrete expertise in these issues, and we put those questions to them. So finally, the clinician, the medical specialist can get that advice back and discuss it finally, as you can see in the process, and discuss it with the patient and their family and their relatives. Perhaps we have to work this better because, as you see in the slide, patient associations are actually in this map put in those areas that probably we have to keep working together and try to find ways of letting on showing in this map how patients representatives can participate. I don't know if you understand this map. You have any doubt? What do you think about the role of patients and patients associations?
Well, I think we could do something more than this. We would like, for example, not we don't have with doctors usually. We have problems with the structures of hospital.
Mm-hmm.
Like to discuss with the, the the head of hospitals about problems of structures like the number of beds, and because in Italy the problem is this is not the doctors, because I think we have very good doctors, but
Mm-hmm.
are the structures where these doctors have to work, which are not at the same level.
Mm-hmm.
So we would like to say that to that we don't when we are in hospital we don't have the good the enough structures to have to stay there.
Uh-huh. So,
We also fear that we are afraid that our doctors maybe get tired to work in this kind, and maybe they want to change hospital
I
or
understand. Mm-hmm.
maybe change the nation, and so we don't want this. So this this is what we would like to do.
Mm-hmm. So perhaps what do you think patients representative can focus on is into strengthening these networks, no? So through these networks, doctors can have more resources, no, and ways of uh, of uh, of 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 I mean not only attending patients but to have more stability and continuity and
In
specialization maybe
in better conditions.
in better conditions. Yeah, perhaps it's related with this core process that we have at the beginning. No, it's perhaps patients association have a very important role in order to facilitate not only the exchange of knowledge, expertise, and resources, but to increase those resources, that expertise and that knowledge. Probably working not directly with not only with the healthcare professionals, but with the European Commission, with the member states, or even the healthcare provider managers. That's the idea. No?
Yes,
I understand.
because we have tried everything, because we were inside that. No, we were patient. We tried on ourselves what it mean to have a transplant, and so I think we are the best person who can say what is going, what is good and what is wrong.
Hmm.
Uh,
Perfect. As I said, this is an ongoing work. So if we keep working together, we can find a way of drawing into this map the role of patients representatives. That's a very good idea. That's great. That's great. So just to move a little bit forward, every year that we have in the network, it's already planned, and I wanted to use this webinar in order to disseminate and to inform everybody what are our activities that has been programmed for this year 2019 and 2020. As you might know, the ERN years start at March and finish at February, so these are the activities that we have planned within the Quality and Safety Working Group from March 2019 to February 2020. Some of the outputs are related to the survey and the collection of the results of the different hospitals within the network. So as I said before, we can compare them to our standards, and we have planned to update those standards this year. But as you can see in the slide, what we have proposed this year is to focus on perceived quality, especially by patients, family, and relatives. And there are two specific outputs that we would like to point out in this seminar, in this webinar. The first one is that we have proposed for the network to make a patient experience tool, probably a questionnaire or any other way that we have, that we are aware that it has been using to collect the patient experience around transplantation, pediatric transplantation. But what we have planned for this year is to have that questionnaire available, to prepare it, and to adopt it in the different hospitals of the network. And another issue that we have planned for this year is to prepare a complaints procedure. We can get to the quality improvement not only by asking the patients, in this case, about their experience, in our case in pediatric transplantation, but also if our stakeholders, our patients, or even patients associations or healthcare professionals detect any problem related to the functioning of the network, we have to prepare some way of collecting those complaints or those suggestions into our network in order to see what we can change of us. Just to move a little bit more ahead, as I said, there are many experiences around how to collect patient experience. In most of our cases in our hospitals, those complaints and suggestions are collected by patient liaison officers who their job is to analyze those complaints to find out solutions of what the patients or the family or the relatives are asking for, and answer the patients. That's already in place in most of our hospitals. Another example would be the surveys that we already know from other issues. But what we wanted to do is to stress out that there are other methods. For example, we have experience in our hospital, Hospital Universitario La Paz, to gather a group of patients into meetings in the hospitals in order to talk to them and to make a focus group. A focus group is a way of interviewing those patients around certain topics that we can discuss afterwards and get into our hospitals in order to change what we are doing. And just to point out other methods. Probably we are all pretty familiar with those methods that we can find in many shops and places, and even administration, where they ask you, as a customer, as a patient, how was your experience in that particular moment? Those faces, that are in colors, and probably some of our hospitals already have experience around this issue, and we can try to see if those experiences can be brought into the network, and we can see how we can apply them. I don't know if you think there are other ways of collecting the patient experience. What do you think, Stefano?
No, I don't have other ideas, because these four kind of a way of collecting experience are very interesting. For example, in Italy, I think we only have paper, no, where people can
write their complaints.
write complaints, but nothing else. We don't have officers, and we don't have focus group. So we have a piece of paper where you can write your complaints, and if you are lucky, maybe you are called back from the hospital, and they ask you more particularly what was the problem. And only that. So.
Well, I just want, as I imagine that probably there are different experiences, in our hospitals,
No, I've seen your hospital in Madrid, and so I know it's a very big hospital, and so I can understand that you can use all these kind of ways, but in Italy the situation is a little different.
Well, as I said before, European reference networks are a way of sharing expertise, and ways of improving, in our case, the quality of what we are doing. So, we of course we are interested, in improving pediatric transplantation. But as I mentioned before, we want to get into our standards other issues that are not only from the professional's point of view. So maybe with our experience, or from the experience of other hospitals within the network, we can share them among us and see how we can implement it in our different hospitals. So that's the idea. I think that this is an overall view. That of course we have to decide what are going to be the best way of getting patient experience in our network, but also trying to help other hospitals to get this kind of work. So that's a good idea. Okay, so just to add another experience, you probably might know Eurordis. Eurordis is a European organization of patients, and in fact, they presented the European Commission last year a tool that is called Rare Barometer Voices. It's an initiative from Eurordis that is used to collect patient needs and experiences, specifically in rare and complex diseases. And as the European Commission has suggested that we have to measure the level of patient satisfaction, it has been proposed as a common tool to use for the European reference networks. But nowadays, that issue is still under debate, and there's, I mean, there has been some work in other common indicators, but level of patient satisfaction is one of the issues that the European Commission will put on the agenda of all the European reference networks very soon. In fact, this initiative from Rodis has already 6,000 patients and families that has already been registered into the platform, and probably it's another experience that we have to look at, in order to see what it can work best for us. I don't know if you know this experience, Stefano. Do you know about this?
I also share this rare barometer to all my patients last week, and many of them told me that they had a reply and they were happy of that.
So it's another tool.
I have worked all last week on this. I shared on our newsletters, on our social networks, and so on.
Perfect. So that it would be very interesting if you can share with us your experience with this tool, because as I was telling, the European Commission has not yet decided which tool is going to use for it, but it's a good idea to know about it. Yep. Perfect. So if we have those experiences, as I was telling you, probably what we have to focus, I'm sorry about the slide, perhaps it's too complex, but I was trying to focus that we have to, if we are talking about patient experience, sometimes we can get that information not only from patients and families straight ahead. I mean, we can ask them through surveys, we can get those complaints and take a look at what they are saying to us. We can make focus groups, or we can have even those phases where we can check out what their level of satisfaction is when we attend them at the hospitals. But we have to keep in mind that we have to think that in our network, probably not many patients are being affected through this tool I was mentioning before, the CPMS. So we have to keep in mind that maybe we have to collect patient experience also from healthcare professionals. I mean, we will have to develop some methodology. So we ask our healthcare professionals, our doctors, our nurses, etc., what they think the patient experience is. So that's a way of getting the information. And of course, through patient associations, that's another proxy, another way of getting that information when we don't have access to the patient itself. And we have, as I mentioned before, to keep in mind that we can have a proactive way of getting that information, and that's the example of the surveys or the focus groups, or ways where we ask before there is a problem. So we ask them, okay, can you tell us what has happened? What do you think the positive points are, and what are the negative ones? And we have the complaints that usually it's our focus in something that has already happened. So we have to keep those two possible methodologies in mind. And finally, at least in our network, we have those two specific organizations that can work on this. In our case, it's the Quality and Safety Working Group. Probably designing questionnaires or how we think the complaints can be managed is something that we can focus in our working group. But there's an ethics and transparency committee that has been proposed by the European Commission to all the networks, and that we are forming and that in some way it would be a group of people, I mean, of professionals, other stakeholders and patients that will be able to, as a third party, to intervene and give advice or to solve or give opinion or suggestions about problems that that any of our stakeholders might arise and might tell us. So that's something that we have to keep in mind because probably in our next boards or next meetings we will try to connect some of our activities also to the Ethics and Transparency Committee. I don't know, Stefano, if it's easy to understand this. Or...
No, it's easy. So
we have many structures in the network, and in some way, what we are learning is by doing. No, we are learning how to use them and how to put them in the right place, so it's useful for the networks, it's useful to the professionals, and useful for the patients. So we still have a long way to do with our working group and other committees in the network.
Yes, maybe just the Ethics and Transparency Committee is the more difficult now to understand because it's a very large issue, no?
Yeah. Yeah, no, but I mean, what we can do in this working group is we can propose the network that, for example, some complaints related to the functioning of the network can be attended by this committee. No, that as a third party can have an independent look at it. No, they are not affected. Perhaps I am affected because I am at the coordination center, and I'm not as independent as I should be, no, in some issues, no. So that's the general idea. Mm-hmm. So, what can be our following steps? I just wanted to point it out. What we will do is that following this webinar, we will inform our hospital, our members of the network of these steps. The idea is that we can launch in the following weeks the collection of not only experiences from healthcare providers, hospitals, but also patient associations. Stefano, we would like your help. So also patients associations can collect which experiences there are already in place in our hospitals. So we know how patients can tell us that something is going wrong, or they can tell us if they are participating in any survey, connected to pediatric transplantation and in the improvement of the transplantation process. The idea is that we collect those experiences, and in the following 3 months, this April, May, June, and until mid of July, we can work in the work. We can put forward in the working group a common model for making a survey that can be, as I mentioned before, completed not only by patients or relatives or families, but also by patient associations or patients representatives, and also by healthcare professionals. And also, as I mentioned before, we have to work on a model, a formula about putting complaints, so also any of the stakeholders of our network can put them forward. The idea is that we need to have, by the end of the 3rd year, that at least 6 hospitals have to adopt that questionnaire. So, well, it's quite ambitious, but I think we can push it forward. And the idea is that we don't only have the complaints procedure, but we start to receive complaints. So the idea is also to disseminate this possibility to all of our stakeholders, not only patients, and to have some complaints this year that can be managed according to the established procedure. We have, as you know, we have a board next May, but probably it's too soon for these issues to be ready. and probably the board of network that is usually taking place in November would be a good point to 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 push all this forward and to see how we are doing in this third year of the network. What do you think? Would you suggest anything else, Stefano?
No, it's very interesting. So I like, for example, uh, to manage the five complaints, because so it's not to receive complaints, but also try to solve, and so this is very interesting.
Mm-hmm.
We have to work together because for example, maybe I don't have alone uh, uh, the knowledge to make a questionnaire, so we
Well,
need.
you know a lot. Maybe the knowledge is no, complementary, no? So
I need this.
yes, it's very valuable.
It's very interesting. Mm.
Hmm. Well, thank you for your feedback. As I mentioned, we will put it forward to all of our hospitals, not only the members of this working group, and well, that's our plan for this year. And finally, just a message to take back home, as we usually do in these webinars. What we are talking about is that quality standards will be updated in this year, and that we will take in this update not only the analysis of the transplantation activity that we have collected recently, but we have to put in our update also the patient and family point of view. Although patient itself does not have a direct relation to the network, we have to develop a way to collect this patient experience, and we want to start asking all of our hospitals and our patient association if they have examples and experience in how to do this, and we share it. So we share it in this working group, and that we have specific outputs and outcomes this third year to be accomplished. Included the adoption of a common patient questionnaire for our network and the launch of a complaints operating procedure. That's the message to take back home. I don't know if you want to add anything else, Stefano, to the people that will be seeing this webinar.
No, it's. I don't think there will be so many complaints because you.
But as I mentioned, it doesn't actually.
But I think that people who who is in the world of transplant usually are happy of what happened. They change his life. They are still alive. So
Mhm.
when everything goes in the right way, you forget about the complaints. You forget about what went wrong. No, so I don't think there will be so. If complaint is the right word,
No,
maybe.
that's the idea. I mean, it doesn't have to be always negative.
Yeah,
It can be a complaint. It can be a suggestion. And
yeah, suggestion should be. I think that the word suggestion is better than complaint.
yes, I agree. I agree. Well, that's the idea. I mean, it's a procedure to let our stakeholders, especially the patients, to let us know what we are doing wrong, but also what we can do better. That's the idea.
Yes.
Perfect. So that's all. Any other question or answers that we need to clarify before ending the webinar? Something you want to add,
So,
Stefano?
what is your I don't know, what is your point of view about knowing the name of the donor? There's this big problem now in Italy,
Mhm.
especially with social network. No,
Uh-huh.
there are a lot of people, uh, usually family of donors, no, who are trying to reach the receiving of and so people is divided.
Hmm.
Some are happy of this, and other and us don't want this. The our law is against it. You can't know
Yeah,
immediately the name of your donor, but there's a very big number of people that want to change this law because they want to know who receive the organ. And so,
yeah, I understand.
what is what is your experience?
I think I don't have an answer to that, but this is a good example of
No.
we can do in the network. I mean, of course, I don't have the experience or the expertise, but I'm sure that other colleagues from my hospital or other hospitals have the experience and the expertise. And this is a way of putting into value these networks. Of course, as I mentioned, there are some legal issues. I mean, specifically, we cannot get into the donation, no, or the organ donation process because it's outside our regulation, no, within the European Union. But
Yes.
it doesn't. I mean, that is not a problem when we have some issues about that. I mean, we can, for example, take that. It is not a complaint. It's like a consultation, an advice that is not related to specifically the transplantation process, but it's related to it. So maybe we can find a way, no, through these procedures that we want to develop. So we have more contact and more experience, no, from the stakeholders, including patients, so we can have some way of getting that questions to our network, so professionals or people who have experience or expertise can answer them. I personally don't have the answer. I'm sorry about that.
I didn't want your answer, but it's a suggestion that we can also try to educate people that the if you are a donor, no, it's not important that you know
Yes, I agree.
exactly the person, no, but you give it to the community, no.
Yeah,
It's and so we could do something maybe also for that if it is in our if we can do it to
very interesting. That's right. Yeah.
educate people.
Yes, yes. Well, that's the idea. That's the idea. I mean, we have to think not only in technical issues, but in non-technical issues, and
I know. I think
that's
that if you want that patient and patient association join ERN transplantation, you will get used that ERN transplantation will become a little less technical and more social.
that's right. That's right. That's
Man.
as we mentioned before. It's complementary. No, I mean it's one cannot live without the other. No, so that's a very good example. I agree. Well, that's all. That's all for this afternoon webinar. Thank you very much for your participation, Stefano.
Thank you.
Thank you to anybody who will look at this webinar in the following days, and we look forward to meet again in these webinars. Thank you very much. Thank you.
Bye.
Bye. Bye.